Good morning, Stephanie and crew.
I'm wearing my Viva Resistance shirt written in science in the periodic table just for you because our new resistance is against vaccine resistance. Am I correct?
Mm-hmm.
It's our new fight.
Yes, it is. It's not new, and it's going to continue, and it may get worse, but hopefully not.
Yeah. No, I know. Well, listen, we have a lot to. First of all, your Team Moderna T-shirt is on the way. I just want you to know we don't get those free. I had to order it and pay for it, but it's on its way to you.
Hey, Karen, could you check our mailbox? We're expecting a T-shirt, please. Thank you, honey.
All right, thank you, Mrs. Doom.
Yes.
Doc, this is, the headline. I'm sure you've seen COVID-19 vaccinations are slowing in the United States just in time for the Indian variant. India is in the throes of a devastating surge in COVID. The wave of infections propelled by a new variant of the coronavirus could spill into the United States. It is, in fact, already here. One thing can spare Americans from another spike in cases. Experts say the country must double down on its successful vaccination program. It could block the new lineage's transmission pathways and stop it cold. But as you just tweeted, right, if coronavirus is uncontrolled, festering in Uganda, Brazil, Thailand, etc., COVID-19 will be here a long, long time. Pandemic is a global crisis, will require a global solution. We must vaccinate every person on the planet. So talk a little about this.
Yeah, so I think most Americans see the world as it is perceived for America. In other words, if we're doing fine, let's say we had everybody vaccinated and we're getting close to herd immunity. The point here, and we're going to be hearing a lot more about this, if it's totally out of control in India, they had 340,000 plus cases the other day. We're having around 60,000 cases a day. So even though their population is higher, it's just completely crazy. But there are many countries in the world where this virus is festering, where they don't have anywhere near enough vaccine supply. So we cannot be complacent about ending COVID in America if we're not ending COVID on the planet. And this is a fundamental truth that it's going to be hard to deal with because we don't have that much control, obviously, over what's happening in India or anywhere else outside the US. So this is a major, major problem and something that may be inhibiting our ability to say we're done with this.
Yeah. Well, Doc, you wrote, it is an interesting, I was just reading a piece in California, where we are, the coronavirus case rate is now the lowest in the continental U.S. We are, so the 7-day rate, like 40 per 100,000 people, dramatically lower than the nationwide rate of 135, per 100,000 people. At the other end of the spectrum, though, is Michigan, right, which the 7-day rate is 483 per 100,000 people. New Jersey, Delaware, Pennsylvania, Minnesota, all up there. And
Maine,
so,
now,
Rochelle Walensky said cases and hospitalizations are increasing in some areas of the country, and cases among younger people who have not yet been vaccinated also are increasing. We all have a role in turning this tide and trend and bringing our cases down. So, where are you in your mind? Again, this is why I'm wearing this shirt, because science has given us a way out. It's given us this medical miracle, truly, in the vaccine, right? But tell us where we are in the fight, in your opinion, right now.
Look, the vaccine is not enough. And when we think about this, California down, Michigan and Maine up, think of this as a ferocious game of pandemic whack-a-mole. This is all I can say about this. California's down now. New York is leveled off. What is it going to be next week? Who knows? It depends on so many factors. How fast are we getting people vaccinated? Number one. Number two, are we sticking with the public health guidelines of masking and staying separate from one another and so on? If we rush this kind of return to normal based on, data from an hour ago, we're going to get in trouble. We are not back to normal. And I think this is the big message that we have to make sure people are getting. And as far as vaccinations are concerned, Stephanie, I think, we are doing well. We got people vaccinated at a very much higher clip than I thought we were going to under the Biden team. But it's still not fast enough. And I still think we have to make sure that we're understanding the dynamics of people who are opposed to getting a vaccine. Like, what the hell is going on here? Why aren't you getting a vaccine? And let's deal with you. And by the way, there's not one reason why so many people are anti-vaxxers. There's a whole range of reasons that range from the ideological and religious to the political to the historical, like I don't trust the government. And it all has to be dealt with at the same time, unfortunately.
We posted a good piece from USA Today with just how do you talk to your loved one that doesn't want to get vaccinated. And I tend to be all bad cop all the time. Just you are idiot, get your vaccine. But I understand that's not the right approach for everybody. And it is actually very helpful in terms of, because, that is, and any polling, right? You're seeing that too. It's someone you trust or a loved one that somehow. And you're right, it may be harder to bring some people around than others, but, you wrote a piece, despite the July 4th timeline, the U.S. is a long way from herd immunity. You said more than 1/3 of adults have now received at least one dose of the vaccine, right? More than 78% of the people over age 65. Okay,
that
right.
was a week ago.
Okay, so this is good. We're at almost half, right? But you said with more than 3 million doses each day on average, the U.S. could be on track to have all adults vaccinated by midsummer. But you said, unfortunately, there are reasons for concern. And there you go. You said we are likely near the peak of vaccine demand. Hesitancy about the vaccine remains a tremendous obstacle. And so let's break these numbers down. You write 35% of Republicans and 32% of essential workers have said they are definitely not going to get the vaccine or only get it if it's required. Another 45% of white evangelicals, of which there are 41 million in the U.S., say they will not get the vaccine. And you said any effort toward herd immunity will have to include the roughly 74 million children in the U.S. So where are we with that? Because right now it's 16 and above, right?
Right.
Yeah.
So
where are we with
the manufacturers are in human trials right now to test efficacy and safety of the vaccine for very young children. We're going to need to get down to infants, children, babies under a year of age are going to have to get vaccinated also. So we made a good start when Pfizer announced that the 12 to 15-year-old age group will be now eligible. They are now eligible, and we need to keep pushing that to a lower and lower age range, because in order to get to herd immunity, we're going to need to have children vaccinated. We also need to make sure that children are protected. We know that they are not affected as much from COVID as adults are, but at the end of the day, there may be variants and mutations that change that reality, and we have to be prepared, and we have to make sure our children are vaccinated. Probably by end of summer, early fall, Stephanie, we will be in a situation where we are able to use appropriate vaccines to take care of our kids.
Okay. So you said the current moment, focus should be on identifying and containing the variants that are currently raging in parts of the Midwest and Northeast. You saying this serves as an ominous reminder as to the seriousness of the variants, right? That this is part of our equation now. You've always said this to us on the show, that we are in a race vaccine against variants. You said still controlling the spread of COVID is not just a question of vaccine availability or administration. It's also important for state and federal officials to step up measures to enforce public health guidelines like masks, distancing, and hand hygiene. In addition, we must expand our national capacity for genomic surveillance to learn more about these variants, right, and where they're going to hit.
Yeah. Well, this is a hard job, Stephanie, and it's not a single pathway. There's numerous things that we have to do simultaneously, which we're totally capable of doing. I mean, one of the things that's been disturbing to a lot of us is that we are not as good at identifying the variant or the mutation as we should be. That requires a process called genomic sequencing. In other words, we have to look at the gene structure of the virus that a person has and see if it's something new. What are the consequences of it? And often, I mean, viruses mutate all the time, and many of the variants are harmless in a sense. Some are not, but we're not sequencing enough. We're not doing enough surveillance. We're not doing enough checking to see where we are with the variants. And that's really a problem. But hopefully we're stepping up. And the Biden administration has just invested a huge amount of money to expand our ability to identify and manage the variants that we're concerned about.
That's great. Another smart thing, I'm sure you'll say that I think they've done is Biden and Nance plans to encourage Americans who do not want a COVID vaccine to get one anyway by reminding them that small businesses can take a full tax credit against paid time off when they provide for the vaccination, if need be, recovery afterwards. Businesses with 500 employees or fewer can claim a tax credit for as much as $511 a day for paid time off to provide their employees up to 10 days for vaccinations and recovery time. They said a quarter of Americans who said they will not get vaccinated may consider doing so if they know they wouldn't lose money. I mean, I think we haven't done a good enough job of telling everybody it's free. It's free, no matter where you get it or how you get it. The vaccine, the shot is free. But also, people that can't afford to take time off work to do it, right?
Yeah, absolutely. These are the little nuances that turn out to be critical for an individual.
Right.
So you might have somebody, I know there are people out there who would be happy to get the vaccine, but the thought in this environment of losing a day's pay or more if they have to stay out of work is a really serious problem. And I'm gonna take my chances because I can't afford. I mean, my rent is dependent on my bringing home my regular paycheck every week.
Yeah.
So if the Biden team has created a situation where, don't worry, that's going to be covered, well, that's an incredible piece of information that people may absorb and have that justify their ability and willingness to go get vaccinated.
Yeah.
So all of these pieces fit together. And the other thing too is this is a responsibility not just to you, but your family, your neighbors, your community. And I think we can trust most people to care about those issues, even if they may have some reluctance. So I think there's pathways to get people on the other side of this.
You look at Israel, doctor. I am all for. It should be required as it is in Israel, to do anything. To get on a plane, to go to work, to go to school, to go anywhere. I mean, that's why they've nearly eradicated it there. Right? They're the most vaccinated country in the world. They're, and as I was saying, if they know anything, they know self-preservation, and they're smart enough to go, everybody get vaccinated. We are keeping this population safe.
Yeah. The government in the United States is always reluctant to make something mandatory. First of all, our structure here is different than Israel. Israel couldn't give that order from on top of the federal government, national government in Israel. Biden cannot order everyone to get vaccinated or to make it mandatory because that's a state job.
Yeah.
So once we get into the states, we have states that
right. I just hope employers will, obviously in schools. I mean, schools, kids have to be vaccinated to go to school. I mean, it shouldn't be
Sure.
Anyway, real quick, let me get to a couple other of your tweets because they're important. You said, I've been asked recently, what are the chances of getting COVID after being vaccinated? The chances of fully vaccinated individuals getting infected with any variant is limited, but because no vaccine is 100% effective. But you said 90% protection is excellent. It also means you vaccinate 1 million people, up to 100,000 could have some level of breakthrough infection. In other words, even if you get vaccinated, then later get COVID, you're unlikely to have a serious case. So that's the other argument to obviously get vaccinated.
Correct. And I think people need to understand these factors, that they may be small in the greater scheme of things, but for individuals, it matters. So if we're saying, look, there's a 10% chance you might not have full protection from this vaccine, most people will say, okay, well, that's good enough. And especially if you think that I won't get serious illness and I won't die, even if the vaccine is not fully effective in my particular case. So all these things are points of information that will help get the unconvinced to make an appointment and go get themselves the jab, as they say in UK.
Well, and finally, you said life is gradually returning to normal, but there should be no relaxation of public health protocols like masking and social distancing. And also, real quick, just, because this is a component, mental health. You said Mental Health Awareness Month. We aren't talking enough about the parallel COVID mental health crisis that will persist long after we've gotten control of the virus. Grief, long return to normal, loss of family income, disrupted school. There's just a lot of things that we're going to deal with waves of from COVID, aren't we?
We are going to, and that's going to probably, the mental health consequences will outlast the physical and medical consequences of the disease. And I've been in touch with Dr. Walensky and others now in the U.S. Surgeon General about what are we going to do about this. And there are efforts being drawn up right now on the federal level to help people understand the magnitude of the mental health components of this pandemic and do something about it.
Yeah. And for some of us, Doc, the going crazy was not a long trip in the first place.
Yeah.
Okay.
I had a really, really tough time last September, October, and November. That's when the sun was, the days were shorter, and then the COVID just really, really wore on me. And so I totally get it.
Chris, and if you had chronic depression, like pre-existing the pandemic, it makes all of that much, much worse to be living in this very bizarre, weird world here of disruption, uncertainty, instability. So, this is going to be the next frontier for those of us who are working for the country in general, but really understanding what we can do about that.
You know what makes it better?
I'm glad it's going to...
Sorry, honey, we're way long, but go ahead.
Okay. No, I'm just glad that the federal government is going to do something about it, understands that it is a problem. So that makes me happy.
No, it is. It's good.
All right. And the one thing that always helps is a Funky Cold Moderna t-shirt, which you will receive momentarily, Doctor. And we highly recommend that.